Passing medical licensing exams isn't just about studying hard, it's about studying smart. In the US and Canada, over 35% of IMGs fail their first attempt at Step 1 or MCCQE1, not because they lack knowledge, but because they use the wrong resources. That's a huge setback. Time is money, and for doctors, time is everything. The right study materials can cut your prep time in half, boost your scores, and reduce exam stress. The wrong ones? Well, they'll waste your time, drain your energy, and leave you unprepared. So how do you find the best study resources for medical exams without the trial and error frustration? Well, as a top scorer in the exams, I will give you in-depth knowledge of the resources I have come to know are useful. That's exactly what we're breaking down today. Let's get into it. Welcome to Dr. IMG Abroad, where we help international and home-trained doctors navigate their journey to medical licensure in Canada and the US. Whether you're tackling the USMLE, MCCQE, OSCE exams, CASPER, FM Pro C, or OET exams, this video will show you exactly how to choose the best study resources so you can study smarter, not harder. Here's what we'll cover today: the top-rated resources for each exam, how to filter out low-quality study materials, hidden gems that most IMGs overlook, and a step-by-step strategy to maximize retention and minimize burnout. Let's dive in. Before we dive in, please subscribe and like this video. It is free to you, but it helps us grow. Let's start with the classics. Textbooks are the backbone of medical education, providing in-depth knowledge on complex topics. But with so many options, how do you choose? Not all exams are created equal. The USMLE is heavily concept-based, the MCCQE1 tests clinical reasoning, and the NAC exams evaluates hands-on patient interaction. Here's what this means for your study strategy. For USMLE Step 1 and Step 2 CK, focus on first pass retention and high yield content. For MCCQE1, prioritize clinical decision-making and public health scenarios. For NAC exams, you need live practice, not just reading books. Let's get specific. If you're preparing for the USMLE, the key is active learning. Here's what works. I am not endorsing any of these books, and I am giving you just my own personal experience and feel from sitting for some of these exams. Best books and question banks, UWorld Q Bank, the gold standard. Don't skip this. First Aid for the USMLE, Step 1. The foundation of Step 1 prep. First Aid is non-negotiable. It's concise, high yield, and a lifesaver during crunch time. Pathoma. If pathology confuses you, this will change the game. Sketchy Medical, ideal for microbiology, pharmacology, and biochemistry. High-yield online resources. Amboss, great for Step 2 CK, integrates clinical knowledge seamlessly. NBME practice exams, your best predictor for Step 1 and Step 2 CK scores. Study strategy for USMLE. First pass, read first aid, watch videos, take light notes. Second pass, focus on UWorld Q Bank. Every question, every explanation. Final pass, take practice exams and adjust weak areas. Fact, 80% of high scorers do UWorld twice before taking Step 1. The MCCQE1 is different from USMLE Step 1. It's not just science-based, it's real-life clinical problem-solving. Again, I am not endorsing any of these books, and I am giving you just my own personal experience and feel from sitting for some of these exams. 1. Best books and question banks. AceQE1, High Question QQ Bank. Most reflective of the actual exam style. Toronto Notes, a great reference book but too detailed for some. UWorld Step 2 CK, overlaps significantly with MCCQE1. 2. Online prep and practice questions. MCC self-assessment exams, offered by the Medical Council of Canada. Amboss covers public health and ethics, which are big in MCCQE1. Ethics, 300 questions online. 3. Study strategy for MCCQE1. Prioritize question banks. MCCQE1 is case-based, so rote memorization won't cut it. Right? Focus on ethical questions, psychiatry, public health, gynecology and obstetrics, pediatrics, toxicology, and adverse events for illicit drugs. These are heavily tested by IE. Take time to mock exams. MCCQE1 is long and endurance matters. Common IMG mistake: over-relying on textbooks. MCCQE1 isn't a memory test, it's a decision-making test. Most questions will be new, strange, and feel so vague. Remember to not overthink, but answer fast. The NAC exams is about communication, structure, and clinical efficiency. 1. Must-have study materials, Toronto notes, clinical skills section, first aid for the USMLE, step 2 CS. Even though CS is discontinued, the structure helps. 2. Best practice resources, practice with a partner or in an IMG study group. Our upcoming website will have lots of resources where you can book an appointment, get free practice questions, get matched to a peer for group studies, and lots more. Stay tuned as we will be announcing that. Online NAC OSCE prep courses like Canada QBank NACI or ACE Clinical OSCE, Geek Med. 3. Study strategy for NAC OSCE. Focus on time management. Each station is 7 to 10 minutes. Memorize frameworks are like Socrates for pain assessment. Practice English fluency if necessary. You must communicate clearly. Choosing the wrong resources can wreck your prep. Avoid these common mistakes. Skipping question banks. You can't just read, you have to practice. Relying too much on books. High scorers use Q banks over textbooks. Ignoring time management. Most IMGs fail because they run out of time. Smartest strategy: use a mix of active learning, like question banks, review with books, and real-world practice with mock exams. Tailoring your approach for Canadian versus American exams. While there's significant overlap in medical knowledge, the exam formats and emphasis can differ between Canadian and American systems. For Canadian exams, MCCQE, focus on resources that emphasize the CanMeds framework. Check the link in the description. Practice with case-based questions, as the MCCQE heavily uses this format. Pay extra attention to public health and preventive medicine topics. For American exams, USMLE, emphasize basic sciences, especially for step 1. Practice with vignette-style questions, which are common in USMLE. Focus on high-yield facts and quick recall for step 1, and clinical reasoning for step 2, CK. Navigating IMG-specific challenges. As an IMG myself, I know the unique challenges you face. Here are some tips. Familiarize yourself with the healthcare system of your target country. Resources like the Canadian Medical Association Journal or the Journal of the American Medical Association can help. Practice medical English regularly if that's a setback for you. Resources like Canopy Medical Spanish or English for Medical Professionals can be helpful. Connect with other IMGs who have successfully navigated the process. Their insights can be invaluable. Remember, your diverse background is an asset. Embrace it. Mastering medical exams isn't about brute force, it's about precision. The right resources will save you months of wasted effort and get you licensed faster. Finding the best study resources for medical exams is a personal journey. What works for one student may not work for another. The key is to experiment with different resources and methods to find what suits your learning style best. Remember, it's not about how many hours you study, but how effectively you use those hours. By leveraging a combination of traditional and innovative resources, creating a balanced study plan, and taking care of your well-being, you'll be well equipped to tackle even the most challenging medical exams. As you embark on this journey, keep in mind that becoming a great doctor is about more than just passing exams. It's about developing a lifelong love of learning and a commitment to providing the best possible care for your future patients. So take a deep breath, gather your resources, and dive in. The path ahead may be challenging, but with the right tools and mindset, you're more than capable of succeeding. Here's to your future success in medicine. If this guide helped you, hit that like button and subscribe to Dr. IMG Abroad. I personally read and respond to every comment, so if you have questions, drop them below. And remember, it's not about how much you study, it's about what you study. See you in the next video.